Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about the remarkable vitamin D. I truly believe, folks, that if everybody in America took an abundant dose of vitamin D every day, we could save hundreds of billions of dollars in healthcare spending every single year, and the quality of American lives would improve along with that cost savings. On today's program, I want to give you the evidence as to why I feel that way. I want you to know what I know so that you can feel the same way and have confidence in the dietary supplements that you take on a daily basis. Today it's vitamin D, one of the most powerful and effective nutrients that we have, and one of the most commonly deficient nutrients that Americans suffer from. So this is really important. But first, let's go to our news. Let's see what's happening in the health world. Consuming more protein from animal sources is associated with a higher risk of death. Researchers from Massachusetts General Hospital evaluated over 130,000 study participants' dietary and health parameters over 30 years. They found those who ate the most protein from animal sources such as red meat, eggs, and dairy were about 8% more likely to die. They also found those who consumed the most plant-based protein were about 10% less likely to die. The study was published by JAMA. Well, folks, this study was covered by most of the popular news outlets. The headline proclaimed that eating red meat or dairy products is highly dangerous to our health, increasing the risk of death significantly. The implication was the increased risk was large and responsible for tens of thousands of deaths every year. In fact, the truth is, and taken directly from the original study, the truth is eating processed or feedlot fattened red meat, such as beef or pork, raises your death risk a paltry 5 to 8%, and it only raises death risk if you also have at least one risk factor for early death, such as obesity, being underweight, drinking excessive alcohol, smoking, or living a sedentary lifestyle with no exercise at all. So in reality, the study found that if you live a healthy lifestyle, you can eat beef and pork along with eggs and dairy without any increased risk of death whatsoever. Now, this is not, however, what the most news agencies reported. One must ask, why would they do such a thing as to report such misleading study results? Could it possibly be due to American media's ever-increasing attempts to sell you pharmaceutical drugs? All of these news outlets feature drug advertisements, so they are already taking money from the drug companies, and they want it to continue. Now, here's my theory. 95% of all Americans eat meat, and the vast majority of these also eat red meat. Many would rather give up breathing than give up their beef steaks and pork chops. If eating red meat, eggs, and dairy greatly increases the death risk, and since no one wants to stop eating them, the only option left to improve our health and decrease death risk is to take a drug to lower your cholesterol and reduce death risk. See what we're doing here? We're told not to eat red meat, can't do it, so I'll take a drug to make up a difference. That reaction is based on misinformation, but this is the truth. Pasture or grass-fed animals produce healthy meats. Feedlot animals are fed grain and silage that causes the animals to gain weight in the form of inflammatory fats that promote cardiovascular disease and intestinal cancers. Processing and curing of the meat of these feedlot animals makes their meat even worse. Pasture-raised organic meats are God-given and healthy foods. And as with all things, enjoy in moderation for best results. Plant-derived compounds have anti-inflammatory effects. Researchers from the University of Salerno in Italy have discovered that certain chemicals found in plant-based foods, and especially in spices, are powerful anti-inflammatory agents that, if eaten regularly, are capable of lowering the risk of disease and developing disabling chronic pain. The study was published in the British Journal of Pharmacology. Well, folks, our previous study helped us to understand that eating fresh pasture-raised meats provides us with healthy nourishment, while eating feedlot-raised meats raise slightly the risk of early death. Our previous study also found including more plant-based protein in our diet improves health, while it reduces death risk by about 10%. This study provides, at least in part, an explanation of why plant-based foods improve health. Plants contain antioxidant agents, along with fiber and a variety of vitamins and minerals that nourish and calm inflammation. And remember, chronic systemic inflammation is a major cause of our leading killers, cardiovascular disease and cancer. Now, this study looked at the spices rosemary and sage's diterpenoid content. These special molecules are found in a wide variety of plants, including spices and salad greens. Including plant foods in your diet will help to provide you with their anti-inflammatory effect, and that's a good thing. Well, on today's Your Health, we will discuss vitamin D. The sunshine vitamin is also considered a hormone that controls our body's inflammation, along with many other things. So please stay tuned for this critical information. We'll be right back. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the auto ship program for additional savings. I'm Cindy Becker for Your Health at a Glance. Do you remember the questions you wanted to ask your doctor after you've left the doctor's office? That's happened to me, so here's my strategy to get ready for a doctor visit. If it's a first-time appointment, be sure your medical records arrive ahead of you. The doctor can review your history quickly. This leaves more time for discussion. For every visit, write down your questions at home. Include a list of medications you take. When you arrive, fill out the medical history forms concisely and accurately. Attach a copy of your questions with the forms so the doctor is aware of your questions before he or she steps into the exam room. Bring a friend for support and have a notepad to take notes. Before you leave, have all your prescriptions. And here's hoping you don't go to the doctor very often. With Your Health at a Glance, I'm Cindy Becker.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's BioNutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net.
Welcome back, everyone. It is just great to be with you today, and we hope you are wonderful and your day is going great. Well, sit back and relax because today's show is going to be very interesting. We're going to be talking about nature's sunshine vitamin. That's vitamin D. You know, this one you're going to be so amazed at the so many body systems that are affected by your vitamin D levels. You'll find that maybe you just don't heal well, or maybe you get sick frequently, you get colds, or if you go to the hospital and have a surgery, you don't heal quite as fast as you should. Maybe D's the problem. Richard, this is just amazing how it's such a total body effect.
It's like our master hormone, not really a vitamin at all, it's a hormone, but it's still a vitamin too. It's really an amazing substance. And in our introduction to the show today, I made the bold statement that we could save hundreds of billions of dollars if everybody took an abundant, proper, higher dose of vitamin D. And I truly believe that. And if after I give this presentation today, you don't believe the same, I've not done a very good job. So let's get to it. There's so much to know about vitamin D, and you want to know every bit you can. Well, what is this stuff? Vitamin D, it's a fat-soluble vitamin that helps our bodies to control and absorb calcium, magnesium, iron, phosphorus, and zinc. If you have low levels of any of those nutrients, it may be because your vitamin D level is too low. It deposits these minerals into bone, and it controls the growth of cells, and it regulates our immunity. Vitamin D is also a hormone that regulates other hormones. The body can make it from sunlight and a cholesterol derivative in the sun, 7-dihydrocholesterol in the skin. And when the sun hits the skin, it turns it into vitamin D, and then it is absorbed and converted into the active form of vitamin D. The dual function of vitamin D makes this physiology complex. This complexity delayed its discovery and full understanding of its role in good health. We're just now learning about vitamin D. We've known a lot about vitamin C and the others for many, many years, but vitamin D is just now unfolding. And it's like a beautiful flower because there's such hope in this nutrient. Dietary and self-made vitamin D is inactive. It must be processed by the liver and into the kidney, into calcitriol or 1,25-dihydroxycholcalciferol before it can do its varied jobs. Vitamin D2 is made by plants. That's the vegetarian source. Vitamin D3 is made by animals. But D3 is up to 87% more potent. It is also the form linked with all the advantages of supplementing because that is the most commonly used supplemental form, D3, in all the studies. Both D2 and D3 are converted to the active form of vitamin D1. Vitamin D, that's 1,25-dihydroxycholcalciferol. 25-hydroxycholcalciferol is the storage and tested form. I know you're writing this down because if your doctor doesn't know about it, well, how do I test this? Ask for 25-hydroxycholcalciferol. That's what we test in the blood to ascertain what our level is. When vitamin D is made the natural way from sun exposure, our body regulates vitamin D. When we supplement vitamin D, we negate these controls, so we need to know how to manage it better. Now, what's the state of vitamin D in America? Well, frankly, it's one of confusion. There are a number of reasons why. The complexity, the dual function. We use differing measuring units. The European uses millimoles more often. We use nanograms. There's international units and micrograms. And sometimes in the same study, they'll interchange these units, and I have to stop and do the math again, and I just get frustrated. I can imagine. You know, here's the thing, though. Even though it's all complex and interwoven and takes math to understand, you don't really have to know all that stuff. That's for the scientists to know. That's for the doctors to know. The bottom line is there's undeniable evidence that the vast majority of Americans are low in vitamin D, and they're suffering disease needlessly because of this lack of knowledge. But for your lack of knowledge shall you perish. Have you not heard that before? And we can change that. The biggest controversy in vitamin D lies not whether we should supplement the vitamin. I've never met a doctor yet who doesn't say, well, yeah, we should be taking 400 at least. You know, they'll say that. Everyone agrees we should. The controversy is how much should we actually take for full benefit? The majority of studies that do not confirm vitamin D's benefits use too low a dose for too short a time. And I still see these studies in JAMA and some of these other journals. Every single week I get one that uses it. You know, if you give somebody 1,000 units of vitamin D and it doesn't relieve them of chronic pain, it does not mean necessarily that vitamin D doesn't help people with chronic pain. If I give you $100 and want to test to see if your quality of life for the rest of your life is improved and it doesn't work out from just $100, that doesn't mean that money does not help people have a better life. I mean, think about it. You can create misleading research that keeps people dependent on medications and in illness so that we have people employed. There, I said it. I was going to try to avoid saying all that today, but it's the truth. That's what's happening in America today. Folks, we use more medicine than any country on the face of the planet. We use half of all medicines produced in the world, and yet we're only 5% of the population of the earth. Something's wrong with that. And if we lived the longest and had the best quality of life, maybe that'd be something worth doing. But that's not how it is. We're 27th on the list of longevity and quality of life. What is vitamin D deficiency? My definition is if your blood level is above 40 nanograms, that's optimal. But unfortunately, only 10% of Americans have that higher level. Below 34 nanograms is insufficient, and below 20 is deficient. Not everybody agrees with that definition, but that's mine. We want it at least above 40. Only 18% have sufficient levels above 20. The vast majority are tragically low. Levels as low as 10 nanograms per deciliter, 10, that's very low, will protect from rickets and osteomalacia. And those diseases are not that common in our country today. They do happen, but they're not that common. 10 will protect you from rickets and osteomalacia, but it will not protect you from our most common causes of death. What is the ideal? This is one of the problems. Okay, you got my attention, Dr. Becker. 10's not enough, 40 is good, but what's perfect? What's ideal? Well, they did a study in Hawaii. It's called the Hawaiian Professional Surfer Study to try to ascertain if a human being were out in the sun and subtropical Hawaii gets beautiful sun, a lot of sun, what would their level be? Well, they assayed, I think it was several hundred professional surfers who make their living in the sun every single day. And what they found, their level was only 27. And they said, that's not very high. We know we get benefits at 40 and more than these people are in the sun a lot, and they don't have that. Why? Well, what do the surfers do? They cover up with sunscreen. They put on a shell, a cover to protect their skin from the rough texture of the surfboard because it can cause a rash. They cover up. And what do we do at the beach? We cover up. We don't want to get burned, and that's smart. Don't get burned. So the next study is, let's look at animals in the field. Animals, the farm animals, the cows, the horses, the llamas, whatever, the vertebrates, they all need vitamin D. Put them out in the field in the sun. They regulate their sun exposure. Their blood level is typically 40 to 60 in the animal kingdom. That's as good a start as any. And we also know to make ideal bone strength, the best bone strength you can make, that's around 40. That's a new study that has just come out. So this 40 to 60 range is very compelling to me because we have examples. But still, we're not farm animals, are we? We are a little different. God made us different. We have our uniquenesses, so we're still trying to process and figure out what is ideal. Who is likely to be insufficient in our country? Who is low? Boston University, 82% are too low. 80% of nursing home residents, 70% of psychogeriatric patients. Who is that? The Alzheimer's, the Parkinson's. They are tragically low, 70%. 92% of children are low. This really concerns me. Formula-fed infants are among the lowest because 1 quart of formula contains only 400 international units of vitamin D. And when a child consumes 1 quart of formula a day, when they finally meet their need, we're off to solid foods. Remember when we were raising kids, when they hit the quart of formula, it's time to get on to solid foods. If you have a dark complexion, you're low. 85% of senior African American women, 90% of African Americans with sickle cell, 96% are low in vitamin D. If you live in northern latitudes, basically it's the Los Angeles, Dallas, Atlanta line. If you live north of that line, you are most probably low in vitamin D. Remember, the sun must be at least 45 degrees above the horizon to make vitamin D. You need UVB, ultraviolet B, at 295 nanometers, that wavelength of light to efficiently make vitamin D. That happens in the summer in the mid-ranges. It happens all year in the tropics. And in the Arctic zones, it doesn't happen at all, ever. So the further north, or way far south, you know, Australia way far south, southern tip of Africa, southern tip of South America, then your risk increases also. Are we time for a break now? All right, let's go to our break and let's talk about the risk of getting too much vitamin D. I think I've got your attention. We need more, but can you get too much? We'll answer that in a minute. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at Bioinnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Bionutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let Bioinnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Could some of your favorite foods be making you sick? Cases of non-allergic food intolerance are on the rise. This is different than food allergies. Recent surveys reveal up to 20% of us may be suffering from food intolerance. People who have a higher risk of non-allergic food sensitivity are those with other types of allergies, such as hay fever, or irritable bowel syndrome, hepatitis C, chronic indigestion, abdominal pain, or constipation. Non-allergic food intolerance can be delayed up to 48 hours or longer, so you may not connect something you ate 2 days ago with fatigue, headaches, abdominal pain, or depression. You can keep a food diary and write down everything you eat. Blood tests can diagnose the problem, or an elimination diet can help you detect the foods that are causing your symptoms. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastro-defense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone, learning today all about vitamin D. Isn't this just amazing? Right before the break, we were talking about who is most likely to be low in vitamin D. There are a few more of us, Richard, that you need to describe for everyone.
Yes, those who wear sunscreen, if you work indoors, if you eat very little dairy, you're likely low, very low. If you have malabsorptive issues, and that usually means chronic diarrhea. That's usually what that is. If you are obese, because vitamin D is trapped into the fat stores, those with secondary hyperparathyroidism, you know it if you have it, your doctor's told you that. Those taking certain medications, steroids. One study showed if a child has had a dose of steroids within the last 30 days, they are 18 times more likely to be deficient in vitamin D. Think of the risk that creates for this poor child. And the symptoms created by that deficiency are usually treated with more steroids. Chemotherapy, cancer patients. Chemotherapy just washes out the vitamin D. Barbiturates, usually used for seizure control in today's world, not as a sedative. And when we are very low in vitamin D, I want to make the point, one of the final signs of vitamin D deficiency before death is seizures. So you don't need another drug, you need vitamin D in that scenario. Phenytoin, which is a seizure drug. Rifampin isoniazid tuberculosis, one of the newer treatments. The old treatment that has come new again is vitamin D and sun exposure for tuberculosis treatment. The antibiotics used to treat tuberculosis wash out vitamin D. We have to compensate. Cholestyramine, Cholestipol, these are cholesterol-lowering drugs, mineral oil, and orlistat to help people lose weight. There are a lot of medicines that affect vitamin D. Check yours over with your pharmacist and physician. Make sure you're not washing your vitamin D out. But is there a point where we can get too much vitamin D? Yes, it is a fat-soluble vitamin, and we can get too much. But it is that level that creates toxicity is much higher than we once thought. Recent study at Mayo Clinic, this is fascinating, paying close attention to this. They analyzed 17,000 subjects who were taking up to 20,000 international units of vitamin D a day. They didn't find any toxicity in any of the 17,000 people. Not one case. Toxicity requires, they concluded, from 50,000 to 1 million units a day, anywhere from months to years. From 50,000 a day up to 1 million a day for several months to years. This depends on your size, the medicines you're taking, your health conditions, your challenges, because when we are extremely challenged in health, say massive trauma, multiple broken bones, car wreck, you need thousands and thousands and thousands of units, 50,000 units a day to adequately heal. So 50,000 a day. If you're low and you're stressed and struggling with your health, take 10,000, 20,000, 30,000 a day for several days to get your level up, and then go down to your routine dose. It's always best to check blood levels to determine dose, and we'll talk a little more about that as we go. So, a second study reported, I think this one was also through the Mayo Clinic proceedings, 20,000 subjects, only one subject, all 20,000 were taking vitamin D supplements. Only one subject with a blood level of 364 had any sign of toxicity. 364. 20,000 who took high dose, no trouble. See, so this notion that at 100 we have extraordinary risk of atrial fib and having to go on Cuban and all, that they didn't find it in any of these studies, which were much larger than that small little atrial fib study. This gives me great comfort. When thousands and thousands, that means our p-value has more merit, okay? And no trouble. 364 before there was. That completely contradicts established theory before, out the door. Most do not take enough vitamin D for long enough. For example, one study, 21 days of 4,000 units, it didn't help those with atopic dermatitis at all. Well, what was their blood level? Going from 10 units to 18 in your bloodstream, it's not enough to do anything. All right. What role does vitamin D insufficiency play in our health? What if we stay in that low state? And the other statement to that is, what if we increase our levels? What kind of savings and what kind of suffering do we spare? Study from Britain. Vitamin D insufficiency raises all-cause mortality by 75%. Any reason you can think of to die, 75% more likely to die if you're low in vitamin D. Boston University finds D significantly affects 291 genes tied to 160 metabolic pathways affecting cancer, autoimmune disease, diabetes, and cardiovascular disease. Vitamin D opens wellness genes. Vitamin D deficiency closes wellness genes and opens disease genes. Think of it that way and you have the essence of vitamin D. Cancer support, perhaps vitamin D's greatest effect. A Norwegian study found, they did a massive study on cancer survival and vitamin D, and they found those who had levels above 32 nanograms. That's not that high. That's easy to do. 4,000 units a day will get you up to that. 32 nanograms, 63% more likely to survive breast cancer, 60% more likely to survive colorectal cancer, 67% more likely to survive leukemia and lymphomas, 81% more likely to survive lung cancer, 76% more likely to survive prostate cancer. Canadian study, if you have your level above 32, it reduced head and neck cancer deaths by 15%. That's one of the hardest cancers to treat, head and neck cancers. British study, 8-point increase reduced the risk of melanoma death by 17%. And what are the dermatologists telling us? Stay out of the sun, you'll get melanoma. Well, if we got a little more sun, we would save lives, wouldn't we? It would sure appear so. Vitamin D also lowers cancer risk. Breast cancer. The typical U.S. breast cancer patient has a vitamin D level of 17. That's the typical. 70% of breast cancer patients have low vitamin D levels. In Australia, they did a study, vitamin D insufficiency tied to a 250% increased breast cancer risk. 250%. Vitamin D supplementation lowers muscle and joint pain during chemotherapy for breast cancer. And if you have a higher level, if you're taking your vitamin D supplements, you're 60% more likely to be alive in 5 years. That pill costs you 10 to 20 cents a day. Do you think that's worth it? I do. How much would that save our country if we all did it? Start adding that up. This is amazing. What about colorectal cancer? Deficiency of D suppresses the release of immune proteins that stop the conversion of polyps into cancer. So when we don't have enough D, that process is left unabated and the polyps turn into cancer. Add a little fiber to that, a little vitamin C, you have a tremendous program to prevent colon cancer. Lung cancer, up to 80% improved survival when we take higher doses of vitamin D. And in Denmark, they did a study and found all tobacco-related cancers, oral, esophagus, stomach, intestinal, lung, anywhere the tobacco touches, you have an increased kidney, increased bladder, increased risk of cancer. Anywhere that is, your risk is decreased. So the point is, folks, until you can stop smoking, get on a higher dose D. Boy, we have more when we return. I hope I can get it all in. We'll be right back. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at Bioinnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Bionutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let Bioinnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. Do you like to exercise outdoors? Many consider gardening one of life's most rewarding activities. The American Heart Association says gardening promotes a strong heart and it helps to preserve brain mass in seniors. Follow these guidelines so your gardening experience will be enjoyable for years to come. Wear a wide-brimmed hat and protect your skin from too much sun. Wear gloves and sunglasses even on cloudy days. Make your posture strong by bending from the knees. Consider wearing knee pads. Start with small jobs. Set a gentle pace and ask for help when moving heavy objects. Pause frequently and drink lots of water. Whether it's trimming bushes, cutting grass, or growing nutritious vegetables, gardening is a great way to get your exercise and get back to the earth. For Your Health at a Glance, I'm Cindy Becker.
Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
Bioinnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings.
We're back, everyone. Just want to let you know it is Special Savings Month at Bioinnovations all month long, and free shipping on your orders over $50 in the mainland USA. So this is a great time. Get all the nutrients you need to stay healthy, including the vitamin D. Well, before the break, we were talking about who is most likely to be low in D and what D helps the most. This is all so fascinating, isn't it?
Yeah.
I mean, when you start thinking about the different cancers, and how the outcomes could be so different. You just want to let everybody know.
I do.
Because we're all touched by cancer. We all know someone who's
absolutely.
currently going through the battle. And if we could somehow help them with this information,
Yes.
it could change their outcome.
Absolutely. And if our oncologists will not help their patients with it, then we're going to do it. We're just going to take that over and do it ourselves.
Right.
You can buy this anywhere. You don't need a prescription for it. You're in good stead doing it. We don't have drug interactions. It's an essential nutrient. We need it first. It should come first. We're talking about cancer and your risk of cancers if you're low in vitamin D. If you are low in vitamin D, you are 40% more likely to die from large B-cell lymphoma. You're more likely to have aggressive cell types in lymphoma. That's the bottom line with lymphomas. How about the leukemias? Double the risk of leukemia if you're low in vitamin D. Have you ever heard of chronic lymphocytic leukemia, CLL? It's one that from time of diagnosis to death is typically 10 years. So people can have a good long life after that diagnosis. You can get a lot of living done in 10 years if you feel pretty good. But if you're low in vitamin D with chronic lymphocytic leukemia, it doubles your risk of rapidly progressive leukemia with death. So that turns a 10-year prognosis into 2, 3. No good. For a 20, 30-cent pill, I'm taking the vitamin D. Prostate, Harvard, those with high vitamin D levels are 57% less likely to develop fatal prostate cancer. Halves your risk, more than halves. 2/3 of low-risk prostate cancers. You know, some prostate cancers are growing slowly, and we don't think, and if you're an elderly male, it's going to lead to your death, but it'll be there. And 2/3 of low risk, you don't have to cut it out, we just watch it. You've heard of this. 2/3 of low risk prostate cancers actually stall, no more growth, or improved their prognosis within 1 year of supplementing just 4,000 units a day. Pediatric cancers, 40% of children who end up at St. Jude's to the cancer ward, wherever they go for their cancer care, 40% have tragically low levels that are affecting their ability to get well from this cancer. They're doing a lot of research in pediatrics, cancer, and vitamin D, and we'll keep you up to date. Skin cancer, those who avoid the sun are 3 times more likely to be deficient in D. Finnish researchers found if we doubled our sun exposure, we would save 10 times the number of cancer lives than lost to sun exposure. The more sun, the more skin cancer, the more deaths there, right? But we would reduce dramatically our internal cancers, and we'd save 10 times the number of lost to skin cancers. That's very compelling to me. Now, I don't want you to burn. Don't go out and burn, but get a little sun. Get a little pink, that's all right. Just don't burn, you know, no painful burns. How about immune function? Now, I'm going to read you some very technical jargon here, but I'm going to interpret it. You don't have to memorize these things, but I want you to know this so you understand how vitamin D affects our immune system. Now, go with me here. Vitamin D activates monocytes, macrophages, and T cells. That's the immune activation. I want a quick immune response when the flu virus comes. If it's low in D, you're not going to react quickly. Next, it improves cell-regulated immunity, inhibits needless lymphocytes, immunoglobulin, and cytokine proliferation and synthesis. What that means is it controls autoimmunity. So I don't react to self when I should be reacting to a germ that's infecting me. Make sense? I don't want an autoimmune disease because I got salmonella. Vitamin D controls that. Next, inhibits type 1 cytokine secreting T helper cell response while activating T helper 2 response. That means when my immune system is reacting, I'm not reacting to, let's say ragweed pollen with allergies, because ragweed pollen isn't going to infect me. It's not going to cause a disease in me. But if I'm reacting, I can be miserable with allergies and asthma and eczema. Vitamin D controls that arm of the immune system. Did you know that? Now you do. Promotes timely apoptosis. Cells should multiply, and then when they end their lifespan, they should die and be done. If they don't quit and die, if they keep multiplying, we call that cancer. Vitamin D controls apoptosis, timely cell deaths, modulates appropriate immune response, transcription factor activation, right response for the right problem. If I have a hair follicle that's got a little staph infection in it, I don't want all my joints to become inflamed. I want my immune system to only attack that little bitty spot that's infected. Vitamin D controls that. Without proper vitamin D, you run the risk of that little infection spreading inflammation throughout your whole body. See, this is worth knowing. This is worth knowing. controls inflammation just enough to get the job done. You know, keep it localized. So all of these things are controlled by vitamin D. And when we are deficient in D, it disturbs that immune balance, promoting autoimmune disease. Multiple sclerosis, inflammatory bowel disease, rheumatoid arthritis, insulin-dependent diabetes, and the inflammation of type 2 diabetes all runs amok. A big study, 187,000 people found those with the highest levels of vitamin D had a 40% less risk of MS, and a recent multiple sclerosis, less risk of multiple sclerosis. Another very large study that they were counting on to give us good information came in, and they found if we take multiple sclerosis, autoimmune disease patient, multiple sclerosis, and give them higher doses of vitamin D, does it change the course of their disease? What do you think? What do you think it did? Did it help people with MS? You bet it did. Vitamin D modifies the course of autoimmune disease, and it is my humble opinion it will do it for most all of the autoimmune diseases. Ulcerative colitis, those people, the inflammatory bowel disease, have terribly low vitamin D levels. I think it will modulate their course as well. Now, we're headed to a break, but let's talk about cardiovascular disease. Could it possibly, vitamin D, help them as well? We'll be right back. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at Bioinnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Bionutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements, because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let Bioinnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
During this holiday season, think of the words of the English writer G.K. Chesterton, who said, "When it comes to life, the critical thing is whether you take things for granted or take them with gratitude. No matter the size of our problem, Jesus cares." The Apostle Paul gave the Philippian church this advice in Philippians 4:6. "Do not be anxious about anything, but in everything by prayer and petition, with thanksgiving present your requests to God."
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
Bioinnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net.
We're back, everyone. I just want to remind you, it is Special Savings Month at BioInnovations all month long. Great prices, best prices of the season, and free shipping on your orders over $50 in the mainland USA, so don't miss it. We're having a great discussion today on vitamin D, aren't we? We're learning so much. Oh my goodness, we are learning what happens when we are too low. Richard, I know there's a few more that you want to cover.
Oh, absolutely. Cardiovascular disease. University of Colorado did a very large study and found that senior citizens with low D levels are 3 times more likely to die from heart disease and 2.5 times more likely to die from any cause. This is a needless risk. As little as 400 international units a day of D improves lipid profiles and cardiovascular disease risk. Deficiencies of vitamin D are associated with stiffer arteries, clogged arteries, poor vascular function, higher cholesterol, 40% more likely to experience ischemia, meaning angina, 64% more likely to have a heart attack, 66% more likely to have high blood pressure, and it's typically the salt-sensitive type. 64% higher risk of peripheral artery disease. 64% higher risk of muscle pain on statin drugs. That's your Lipitor class, causes pain. If you're low in D, it's more likely to do that. 81% more likely to have a fatal cardiac event. That's usually an arrhythmia that does that to you. 300% more likely to have postmenopausal hypertension. Adding just 2,000 international units of vitamin D3 to a statin cholesterol drug reduces cholesterol an extra 29 points and triglyceride an extra 37 points. It makes your medicines more efficient. A review study, low D increases statin myopathy. They also, another study found if you add B12 to the D, it even reduces the pain and muscle soreness of statin therapy even more. 4,000 units of vitamin D3 a day for 6 months improves heart failure ejection fraction, and they also found that it reduces the scarring. It stops the remodeling of the heart, so the heart doesn't continue to get bigger and bigger and bigger and bigger. See? Heart failure and vitamin D, please get on it. Please get on it. Here's one that's very important. Leslie Ray Matthews, MD, Morehouse University, Surgical ICU. They wanted to know if we gave large doses of vitamin D to our massive trauma surgical ICU patients. You're in a car wreck, you have 12 broken bones, internal bleeding. Are we going to have fewer heart attacks in these people with high-dose vitamin D? So they did two groups. The control group was 50,000 units of vitamin D a week. And most people say, oh, that's huge. That ought to make a difference. The other interventional group was 50,000 a day. Now, these people are fighting for their lives. This is not a little cold. This is life and death for them. Their body needs huge amounts. Get this. Get this, what 50,000 a day did for these critically ill people. They had half, this is a big study, 500 plus patients. They had half the rate of heart attack, 8% versus 4%, half the rate of heart attack. Those who stayed in, those who took 50,000 a week were in the hospital on average 36 days. Those who took 50,000 a day were only there for 8 days. Those who took 50,000 a week spent $140,000 on average, and those who took 50,000 a day spent only $32,000 on average. Do you see the cost savings? Am I getting it across to you? Did the Affordable Care Act have anything about vitamin D in it? Not one word. Not one word. That needs to change. That is profound. Now, neurology. What about autism? Yes, it's associated with low D. It's not the only reason, but it's part of the cascade of events that ends in autism. We know that from Dr. Ames at UC Berkeley. Brilliant scientist. Has written about this extensively. Seasonal depression, clinical depression, absolutely linked. Add a little vitamin D to your antidepressant, it improves its activity. Add the B vitamins, it's even going to help even more. A little fish oil to that, and you're going to get out of this depression. The majority will. There are ways to help people with depression, and it goes way beyond just taking drugs. France, those with high vitamin D levels, 77% less likely to develop Alzheimer's over a 7-year span. Seniors, keep the brain strong with vitamin D, B vitamins, fish oil, exercise, religious study and practice, socialization. Stay strong. Lowers the seizure threshold when you're low, and many people are on medicines that deplete vitamin D even further. And when they have a seizure, it may be because it's vitamin D deficiency, but they're given another seizure drug. Please be on vitamin D if you have seizure disorder. Let's go to musculoskeletal health. Bone health optimized at a level of 40. Wake Forest, if you're under 30 nanograms, you're 30% more likely to have mobility issues and 70% more likely to be in chronic pain if you have low D. 3/4 of hip fracture patients and half of all patients undergoing orthopedic surgery are deficient. And this deficiency impedes your healing and leads to your chronic pain. I can't emphasize this enough. Disc disease, fractures, massive trauma, car accidents. You're going into this scenario with tragically low vitamin D levels and you're stuck in chronic pain, and now you are dependent on narcotics. And it all started because you blame the accident. Of course, that has everything to do with it, but you probably would have healed by now if you'd had proper vitamin D levels. So this has everything to do with chronic pain. Let's do a little bit about children and pregnancy. 7 out of 10 pregnant women do not get enough D. When mothers get enough D, their babies have better growth, better brain function, fewer eating disorders, and better lung development. The children grow up better, they're stronger, they have a better start. They have pediatrics. If a child takes 1,200 units a day on a regular basis, 64% less risk of influenza and 50% lower risk of respiratory infections. If your child is struggling with one infection after another and it's affecting their school attendance, please, vitamin D, 1,200 units a day. Probiotics, fish oil, and a good multiple vitamin with good sleep. And let the child play in the sun. We're going to break that cycle. Well, folks, we have more. We haven't even talked about diabetes, improved blood glucose control, less risk of developing diabetes. But when we return, I think we're to the point now, it's really important that we talk about how to take vitamin D properly. That's our next step. We'll do that in our wrap-up in just a minute. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker Spa nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Are you one of the 25 million Americans who suffer from an autoimmune disease such as rheumatoid arthritis or lupus? Autoimmune diseases are caused by a misdirected immune system that attacks the patient as though their own cells are a foreign invader. You can manage the symptoms of an autoimmune disease by living a healthy lifestyle. Here's a strategy. Avoid unnecessary exposure to pollutants and chemicals. Eat a simple organic-based diet free of junk food, low in sugar and food additives. Avoid foods that seem to cause flare-ups of your disease and stay active and exercise. Scientific research shows natural agents are of great benefit to the autoimmune disease patient. Yogurt helps to maintain normal bowel flora. Fish and flaxseed oil and noni juice calm inflammation. Vitamins and minerals provide nutrients for proper immune function. Keep fighting and don't ever give up. A positive attitude can make each day a little better. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. Your Health is brought to you by Bioinnovations, trusted products for your health and well-being.
We're back, everyone. Just a quick reminder, it is Special Savings Month at Bioinnovations. Don't want you to miss it. And free shipping on orders over $50 in the mainland USA. So great time to get what you need to be healthy. Richard, there's a few more on the deficiencies with different health conditions and vitamin D.
Yes, and diabetes is so important because there's so many of us who are now diabetic. If your blood level of vitamin D is higher, you have a lower risk. The higher the D, the less risk of type 1 diabetes, type 2 diabetes, and polycystic ovarian syndrome, PCOS. It's all diabetic. Lower inflammation levels in diabetes if your D is up. Improved wound healing, improved diabetic foot ulcer healing if you have a higher vitamin D level. Faster healing in broken bones. Any trauma is going to heal faster. You'll have a lower blood pressure, up to 11 systolic points difference with higher vitamin D level in diabetes. Some of the other unique advantages of vitamin D, it helps gingivitis, that's been studied. It helps menstruation problems, things like endometriosis, dysmenorrhea, and difficult menopause. Young girls with low vitamin D levels have early menarche, and we know without a doubt now early menarche leads to higher risk of ovarian cancers, endometrial cancers, and breast cancers. So it helps to normalize the menstrual cycle. It's really tremendous for that. It helps slow the decay in lung disease. People with low vitamin D have rapidly progressive lung disease, and that leads to atrial fib, you know. And that's something we don't want to have. That's a tough one. Also, here's one that really got my attention. The higher your vitamin D level, the lower your body toxin load is. Because vitamin D directly controls the cytochrome P450 and how we get rid of these toxins. So it helps you to detox. Isn't that amazing? All right, let's get to how we take it. 10 30-minute tanning bed sessions over 30 days equals about a 60,000 unit dose of vitamin D. I recommend you take a pill. It's better. Dr. Hollick from Boston University, sunbathing in a suit until you are pink creates 10 to 25,000 international units. So that tells me it's okay if we're low to spike up our levels with a run of 20,000 a day for a little while. Most people, 4,000 international units of vitamin D a day will give you that 50 to 70 blood level. Some people, 1 or 2 out of 100, will get an exceptionally high level from just 1,000 units. This is why I always say it is best to determine your vitamin D dose by your blood level. So please ask for yours to be checked. If you're a cancer patient, please get it around 70. For the rest of us, most of us, 50, 60, 70 is good. You may want to go higher. And please understand, remember the Mayo Clinic studies? Thousands and thousands of people, no one had any trouble till their blood level was 360. No troubles. And the drugs that affect vitamin D and vitamin D that affects drug, it usually lowers vitamin D levels. We don't get high levels of medicines from taking vitamin D. So in general, you're safe there. Well, folks, I hope I got your attention on vitamin D, and I hope your next step is to increase your dose of vitamin D and get it up to those healthy, productive levels. We'll see you here tomorrow. Bye-bye, everyone.
Thanks, everyone. We'll see you.
Hello, my name is Pastor Doug Stone. I'm the pastor here at Our Father's House Church. We invite you to come to our church services. Our church times are on Sunday at 11 o'clock. Wednesday night Bible studies are at 7 o'clock. Our Father's House Church believes that faith can move mountains. I invite you to join us at 2242 Wren Street, North Charleston. My email is pastordougoFH@gmail.com.